Hi, friends, to all my patients out there and all the people who are looking for breast implant surgery. I'm going to quickly, over the next 2 minutes, show you what you can achieve with a breast implant surgery in very, very simple words. I know this is not the best time. We are in a pandemic. You're sitting at home, but you're watching YouTube videos. And if some of you have ever wanted to consider a breast implant surgery, they're not happy with the size, just watch this video. I'm going to add a little bit to your knowledge. And when the things settle down, maybe you can take a call wherever you are in the world. So, for example, now we're looking at a situation where this is the breast of any patient. We want to put in a breast implant. So, how do we do that? We make an entry either from here, or if this is the breast, so this is my preferred entry point, which is called the inframammary crease. There are some doctors who do from the areola, and there are some doctors who do it from the axilla as well, from here. My preferred here, because this leaves the least amount of scarring. It's more direct. There are very high chances of asymmetry when we go through the axillary route. Then with the areolar route, there is a theoretical chance of having infection into the milk ducts, causing problems in future feeding. So this is where I go through. I always use either Motiva implants or Sebin implants. So we don't use the Chinese or the Korean implants. Now going from here, so this is all the fat tissue inside. A lot of fat, a lot of breast tissue inside here. Then this is the muscle, the pectoralis muscle. The pectoralis muscle. Then here there is a layer above the pectoralis muscle which is called the pectoralis fascia. So this is called the pectoralis fascia. What are the approach? So surgeons often do, they put an implant either here or they put an implant here. So this is the bone. So if we go even further behind, this is the bone. So this is called the glandular, this is called the subpectoral approach. They have their own problems. Now I have learned it from Brazil. I do it by what is called as a subfacial approach. The subfacial puts the implant here. So we lift off this layer, which is called the pectoralis fascia. This implant, so the muscle gets separate. So for example, if I'm going to draw it again now, this is the breast, the fat, and then the muscle, and the fascia is lifted off like this. So this layer is lifted off like this, and the implant is put here. So this, friends, is the implant in what is called as the subfacial position. And eventually this breast from like this becomes like this. Now you clearly see, so this is the nipple area. And so the breast, which was something small, something like this, has now become bigger like this. And if we go inside so this is the fat, then the implant covered by the fascia, and then the muscle. The advantages of this approach is that it is less palpable. There is good projection. So it's implants behind the muscle often are pressed by the muscle. They're not able to show the projection. So this gives good projection, very low capsular contracture rates. And sometimes if the implant is put here, when you touch it, when you touch the breast, when you press the breast, you might feel the implant. When you put it here, the implant is less palpable. So, so this is my favored approach, my preferred approach of putting the implants. Now, the implants that we use, the Motiva and the Sebin, are world-class implants. They are guaranteed for life. Motiva, in fact, gives you guarantees for even capsular contractures. So this is it. The procedure takes about 25 to 30 minutes, maybe 35 minutes at most. Same day discharge, office next day, exercise, gym, everything after a week. So think about this. The breast implant is much easier than you ever thought it was. And at this time, it's just time to gain a lot of knowledge. Prepare yourself for when this comes to an end. You're going to get back to normal life again. And what you can, you have so much of time to learn about things. So have a great time and keep up your spirits. You're going to need them because you're going to get back to work very, very fast.